Hello, everyone, and welcome to the Find Your Feminine Fire podcast, as well as our first expert interview for the 21 days of delicious breast care. I am so thrilled today to be talking with Dr. Felice Gersh, and we're going to be diving into circadian rhythm and inflammation and how that affects our breast tissue. So, if you're looking to increase wellness and vitality in your breasts and beyond, tune in as we dive in. And I'm so thrilled to have Dr. Gersh here today. She is an award winning physician as well as a rare combination of double board certified OBGYN who is also fellowship trained and board certified in integrative medicine. So, she has so many great with so many years of great wisdom to draw upon, and as well as being, yearly award winning as a top physician. So, welcome, Dr. Gersh. Thank you so much for being here today.
Well, I'm so happy to be here and to talk about this topic, which is so critically important to every woman and so much on her mind, the whole concept of how to optimize the health of her breasts.
Yes, thank you. And I feel like, it's not something women think about a lot, but I do feel like it's just a very important issue, especially now that it's Breast Cancer Awareness Month, just to bring attention to this, not just this month, but always. So, and I know that you're really dedicated to women and focusing on women's health, as well as kind of really having that unique um, emphasis on how our rhythms and our hormones affect our health overall. But I'd love to just have you start with sharing a little bit about, why you're so passionate about this work that you do.
Well, it is very much of a passion for me. It all began way back when I was a kid, actually, and my parents sort of steered me into a direction that I had three choices for a career. It had to be something of service, something that would actually help people. So I could be a teacher or a lawyer because they felt they were actually lawyers. They felt they actually helped people a lot, or a doctor. And I was very good in math and science. And I thought, well, this is really what I want to do. And I started volunteering at the local children's hospital. And I loved arts and crafts. So I did arts and crafts with the children who were hospitalized. And it just made my heart sing to see children smile and getting better. And then when I went to medical school and I thought about what kind of a career would really suit me, I just fell in love with OBGYN. I felt it had it all. It had excitement, drama, romance. It's like you had your adrenaline rushes when you went in to dash to make a delivery. And you also had consistency of care. So you could see women for decades and you would take care of them often as their primary care doctor. And then, of course, you could do high-tech surgery. So it really had everything that I wanted in a career. And over the years, I've really sort of morphed. So almost like about a decade ago, it was my time to give up obstetrics. And I loved doing it. And then after that, I felt so lost because I had so much circadian rhythm dysfunction from all those middle of the night deliveries. And I just couldn't, for my own health, continue doing it for longer after that point. And that was what turned me really down the path towards integrative medicine, looking for ways to optimize women's health beyond doing things like surgery, which I was very good at, but I didn't want to do end-stage disease care. I wanted to prevent the need for surgery, not just do surgery. And I knew that there had to be more than a birth control pill as a treatment, because that seemed to be the go-to for everything. So it led me here today with you looking and helping to explore with other women how to really live the life of a healthy woman, which really doesn't get enough attention because we live in a very challenging world. And so that's what I'm here for, to help women to really optimize their health.
And I love that integrative approach because I think, so often we have everything so segmented. And so, as all these years of working with women and, especially regarding our rhythms and things of that nature, I'm curious how, when it comes to breast health, what are some things that we can do to really optimize that, not only just obviously for our breasts, but in general?
Well, that is exactly the way I look at it. The breasts are not a separate part of the body. In fact, just like you mentioned, everything in the body is a whole. So, and in a way that's good, and in a way it's bad, depending on how you look at it. So if you do something that's good for your brain and your heart, it's going to be good for your breasts. On the other hand, if you do things that are bad for your brain and your heart, they're also going to be bad for your breasts. So what we have to look at is the female as a whole. So we are amazing creatures. We're rhythmic in so many ways. We have our circadian rhythm, which is the 24-hour rhythm. But as women in the reproductive years, we also have lunar rhythms, the beautiful dance that we have with the moon, and we have the seasonal rhythms as well. And then we have rhythms that are called ultradian rhythms. So these are like pulsating rhythms throughout the day, where we have pulses of hormones and different signaling agents that vary throughout the day. So nothing in our bodies is static. So it's really foundational to know that everything is sort of in a flux, in a beautiful rhythm. But in our lives now, they're so disrupted, our beautiful rhythms. And so the price is to be paid in virtually every system of our body. And the breasts are very vulnerable. So we're seeing an escalating amount of breast cancer in both the premenopausal, which is really increasing, premenopausal breast cancer, and postmenopausal breast cancer, as well as women sort of lose their rhythms with age and with environmental toxins and with our loss of our, alignment with our day, that we're seeing too much light, we're going to bed at the wrong time, we're eating without any kind of rhythm. Many people have some sort of caloric drink sitting on their desks that they're sipping all day long. So essentially, there's no rhythm to their eating. And so we need to go back to really fundamentals to get in alignment with the beautiful rhythms that we were born to be living with, and now we're living against.
Yeah, and I'm curious what some of the main, symptoms that you see when our rhythms are so disrupted. What are some things that women may notice is going on that they can be like, I am feeling this way?
Well, when you have a disruption of your rhythms, you will have what I call metabolic chaos. Essentially, every organ in our body works in conjunction with every other organ. It's a beautiful synergy. And of course, the brain is very circadian. We have like a totally different brain in the day and in the night. So if we look at our brain to begin with, starting at the top, when we are misaligned with our rhythms, our brain is not going to work right. We will have brain fog. We will have mood problems. We'll have depression, anxiety, and sleep problems. So we won't be able to sleep properly. So our brain is just clearly not going to be optimally functioning when we do not have proper rhythm. And if we jump down to the liver, which is the metabolic powerhouse of the body, when the liver is off its beat, it's going to go into a state of inflammation. And we know that inflammation in the liver can ultimately lead to fatty liver, which is now an epidemic. Some people estimate over a third of people, maybe close to a half, have some degree of fatty liver. And when you have this abnormal fat deposition in the liver starts to do things abnormally, unrelated to what the body needs. So it can do what we call uncontrolled gluconeogenesis, where it's just pouring out sugar. And it can pour out fat, triglycerides. And of course, that can lead to cardiovascular disease, metabolic problems like diabetes and prediabetes, which are very prevalent in women who are living off the beat, as I say. So you're going to have brain fog, you're going to have mood problems, sleep problems, you're going to be fatigued, and then you're going to have increased risk of insulin resistance. And of course, when you have high levels of insulin, that causes fat deposition. So then you have weight problems. So you can't lose weight. You can't have high insulin and high sugar and simultaneously be losing weight. So then, and the weight tends to go to the middle. So then you get the infamous belly fat. So you can see where this is heading. And then when you have chronic, you end up getting gut inflammation, because it turns out that everything in our GI tract is very rhythmic. We have a special nervous system of our gut called the enteric nervous system. That's why some people say our gut is like our second brain. Right. And that is very, to say the least, rhythmic, right? We should have the gut doing things in the day and not at night. So people who have to go to the bathroom all night long, whether it's actually for urination or have bowel movement, that's really wrong. That's a circadian rhythm problem, because our bladders should not fill at night and our gut should be quiet at night. And we should be doing everything with the rhythm of our gut. And as well, we have bacteria in our gut, our little microbes, our gut microbiome, and they have clock genes too. It turns out every living creature on Earth has clock genes. Clock genes are what keep everything moving on the beat. And they don't know what time of day it is except by when you eat. And so if you're eating all day long, if you're eating late at night, you're going to have major circadian rhythm dysfunction in your gut, and that can increase more liver inflammation, irritable bowel syndrome, and so much of our immune system resides right around our gut. So then you get the wrong bacteria. They make what are called endotoxins. And then you don't have the proper mucus protectant, and then you get impaired barrier function or leaky guts. And these toxins go right through into our own inside of our body where the immune system is. And the immune system is like, oh my gosh, invaders, and they explode with inflammation. Then you have systemic inflammation, which further drives insulin resistance, and the inflammatory cytokines go into our brain, creating more inflammation in our brain. And all of this is happening in our breasts as well with the inflammation. And then you have breast inflammation. So when you have a state of chronic inflammation, that can lead to DNA breakage, and that can lead to cancer. So all of this leads ultimately to a state of uncontrolled insulin to try to counter the uncontrolled, blood sugar and all this chronic inflammation. And the immune system is also circadian. So you're also going to have a disrupted immune system as well. So it's not going to be optimally functioning either. So you can see how really the circadian rhythm and staying on the beat for the 24-hour rotation of the Earth is critical to every single function in the body. And this has just been completely ignored. But of course, we didn't even know that we had a circadian rhythm. We didn't know we had clock genes or a master clock in our head until only about 20 years ago. So we had no clue that any of this was really important. We just knew that people who worked odd hours or stayed up late at night or ate randomly, they just didn't really feel well. But we didn't put all the pieces of the puzzle together until very, very recently.
Yeah. And I'm curious, what are some things? So if we wanted to move from being off the beat to getting back on the beat,
yeah,
what can we do?
There's so much we can do. The first thing that you should start with is eating to the beat. So that means that you should have breakfast. I know that that's sort of become fashionable now to fast through breakfast, but that actually is not optimal at all. It really helps. A lot of people know, even if they don't know anything about rhythms, they somehow know that there's a rhythm to cortisol and that you should have high cortisol in the morning, and then it should be low at night. And then the opposite rhythm is sort of the melatonin rhythm, where you have low melatonin in the day, and then melatonin comes up at night. And that actually is related to eating as well. So we want to eat to be in alignment. So we should eat no more than 3 meals a day, no snacking. Somewhere down the line, somebody came up with this idea, which is really bad, that you should eat like every 2 hours all day long to maintain your blood sugar and your insulin. That is not how we evolved. Can you imagine that the human species would be here if, 20,000 years ago, humans had to eat every 2 hours in order to maintain blood sugar? So that is not how our bodies work. So we're much better off not doing that. And so we should eat breakfast. And in the beginning, I call it like the beginners, eat breakfast, eat lunch, eat dinner, stop eating, preferably by 7 p.m., because between 7 and 8 p.m., our pancreas actually goes to sleep and our insulin is not going to be produced properly. So if you eat after 7, 8 at night. Now, of course, we can get away with things sometimes, but if you do it on a regular basis, you're going to be stressing out your pancreas and increasing your risk of diabetes, prediabetes, and weight gain. So we don't want to do that. So we want to have breakfast, try to do it the same time every day of the week. Because if you do crazy different things on the weekend, we call that social jet lag. That's because if you have real jet lag and you're constantly flying across time zones, that's a problem. But if you do it to yourself by having different schedules every day of the week, like you're in different time zones, that's equally bad. So, and obviously special occasions or whatever, but we want to try to do this most of the time. So you try to have breakfast the same time every day, lunch and dinner. Now, when you get, I'll call more advanced, then you could do, because most people don't want to give up dinner, so I understand that, but you could do breakfast and then skip lunch, or do what I do, which is often I'll have like a fast bar, which is like a nut bar that was created by the fasting company, El Nutra, where actually I'm on their medical advisory board. So I love what they do. And we can talk about fasting as helping with the beat. So, or you could have some olives, or you could have like a small piece of avocado or some macadamia nuts. What are those? They're basically fat. So if you eat fat, you're going to keep your insulin level down. So you can have like a little fat, just a little bit, with like a big mug of green tea or some herbal tea for lunch. And if you have a good sized breakfast, you're not going to be very hungry. And you may take a month or 6 weeks to adjust to this schedule after you've gotten on the beat of eating just breakfast, lunch, and dinner. And then after maybe a couple of months, you can move into the more advanced, where you do this sort of fasting mimicking type of a thing for lunch, or just even skip it if you have a big enough breakfast, and then have an early medium-sized dinner. So that's not too bad, you know, you're not snacking, but you can drink and hydrate all the time. And if you desperately need a snack, you know, have a few olives or a little sliver of avocado if you desperately have to have a snack. But usually by hydrating, and if you have a big breakfast, it's amazing. That actually reduces your appetite for the rest of the day. And for people who want to lose weight, I tell them to have a big raw vegetable salad. I know that's not the traditional American breakfast, but there's actually, most people are trying to lose weight. I mean, you are great, and not everybody is trying to lose weight, but probably 80% of people are trying to lose weight. So maybe 90. So if you start your day with a big vegetable salad, you know, all raw food, then that is amazing. That actually helps lose weight. They found that if you eat the same food raw or cooked, if it's raw, you're more likely to lose weight. And if you eat a nice big breakfast, you'll be less hungry for the rest of the day. It gets your metabolism going, gets that cortisol down. So cortisol increases insulin resistance when it stays up. So we don't want to have high cortisol all day long. That's why we don't want to skip breakfast. And this will really get you going on the beat every day. The other thing is getting bright light. So it turns out that our dermatology friends, that they got it a little wrong. What can you say? A lot of people, you know, I've gotten things wrong in my life too. So we have to say, when I was wrong, I was wrong. So the idea that you should avoid the sun is very bad advice. Now, we don't want to get a burn. We're not advocating for that. Excuse me. So we don't want to get a burn, but we do want to get sun. So it turns out that the sun in our eyes, we have special receptors actually for sunlight in our eyes that go directly to the master clock that sits atop the optic nerve in the hypothalamus of the brain. And that helps to get our clock back in alignment. It's called entrainment, because every day it drifts a little bit, and that bright light in the morning will get your master clock in your brain back on the beat. And it's even better than that. Not only does it do that, but bright light increases our body's production of serotonin in our brain. And serotonin is that neurotransmitter that makes us feel good and alert and calm. And when we get that bright light in the morning and another set of bright lights, like for about 15, 20 minutes with no sunglasses, with the bright light in the midday, that helps us from that serotonin that we're making at night. Serotonin turns into melatonin. So you sleep so much better, which is so important. And a lot of people, one of the reasons why they don't sleep well at night is they don't get enough light in the day. They're living in these like artificial caves, you know, called business cubicles or whatever, you know. A lot of people don't even have windows where they work, and or if they have windows, they're very darkened, you know, with you know, like the to keep the sunlight out. So they're very dark windows, or they have shades all over them, and so they really don't get much sun, and then they're just inside all the time. And then they come in, it's dark in the morning, then they leave, it's dark at night, and they never see the light. And of course, we know that there's seasonal affective disorder that people in northern climates get when they don't get enough light. Well, we do that to ourselves, even in where I live, sunny Southern California, some people never see the sun. So getting that bright light in the morning, first thing. And if you can't, because you're in a dark place, you know, the seasons and it's dark in the winter, you can get a light box. You can even get a dawn simulator where the light gets brighter and brighter. So there are many ways they're very inexpensive to get a light box. If you do it with a light box, you want to get 10,000 lux. That's how they measure the light in the morning when you first wake up, and then in the midday for also like about 15, 20 minutes. And this will make all the difference in having restorative sleep and having energy and having serotonin. And remember, we talked about mood problems. Women who don't live to the beat have so many mood problems. Something like a quarter of all women now are on antidepressants. What is that saying about us, And they have a whole host of problems associated with them, along with the fact that they don't usually help for most women either. And they have, all these side effect profiles. So we can deal with so much with these mood problems by getting enough sleep, by getting enough light in the day, like dark at night. That's another thing. Like I personally sleep with a sleep mask, which because I get too much ambient light in through my windows at night, and I, there are cracks and everything, and even in hotel rooms, because I travel and speak a lot. There's all these little blinking lights everywhere on TVs and radios, and I'm going around with, I used to go around with the, grab the towels from the bathroom and try to cover everything. Now I just put on, I just put on a sleep mask, because not getting enough sleep will increase breast disease, breast problems. So, and of course it links to everything. So when you link the breast and breast health to the health of all the rest of the body, then it makes it easier to sort of correlate everything, because what's good for your brain is good for your breast. What's good for your heart is good for your breast. And, and essentially most of us, our bodies are kind of sinking in the poor scheduling. And then of course with the food. So we want to start with eating on the beat, and then getting the light. And that's a good way to start, to get back on the beat.
And I have one question too, to go back to the fasting part, because I know you mentioned, for women especially, it's important to eat breakfast. And you are right, because I know there's the intermittent fasting is so big now where you don't eat breakfast. So I'm curious why for women it is so, you kind of dived into that, but how can you use that intermittent fasting while still eating breakfast, I guess? So
oh, sure. So things come and go in fads, and for whatever reason, this fad has developed that you should fast for like 16 hours, and it should be through breakfast. And then you start eating in the midday or early afternoon. That is not science. That is not a good idea. I wish people would just stop that. Like, stop it. Okay, so you're going to maintain your high cortisol, which drives insulin resistance and inflammation. So we do not want to do that. Now, if you compare, like everything is, if you compare to the standard lifestyle or the standard American life, okay, where you're eating nonstop, you're eating for breakfast, pastries, and bacon, or something like that. And then you're drinking a very high sugary juice, and you're drinking, coffee with all kinds of syrups in it. So, and then you're drinking that coffee syrupy drink all day long. And then for lunch, you're eating fast food, fries and some kind of a burger. Okay, so if you compare fasting through breakfast to that, then you're going to be better off fasting through breakfast. Right. But if we compare it to something better, like having a vegetable stir fry with maybe organic tofu, or even, a couple of organic eggs mixed with, like scrambled with a bunch of vegetables, or my favorite is the breakfast salad. If you compare it to that, then what I'm recommending wins hands down. Okay. But if you use the standard American crappy lifestyle, anything is going to be better than that. Never eating is always better than eating that stuff. But if you want to go for what's really optimal, then you want to do fasting, but you want to do it right. So remember, it's not just what you eat, it's when you eat it. And it's not just that you fast, it's how you fast and when you fast. So for example, if you eat all night and fast all day, that's a problem, because we are diurnal, we are not nocturnal. So if you fast for half of the day, when we should be active and our immune systems are like most robust, and that's when you're not eating, that is giving the wrong clues to your body, okay, about what's going on. So what you want to do is fast for 13 hours. Now, that would mean, and you want to eat breakfast optimally within 2 hours. You don't have to get up and instantly eat, but optimally by 2 hours after you get up. So that's giving you a nice little cushion there. Now, so where's the 13 hours coming from? From research, okay? We didn't make that up. And they've had studies, for example, women who've had breast cancer. Okay, so they've had breast cancer. Now you want to not have breast cancer recur because you want to live. Okay, the studies show 13 hours, not 12 hours, unfortunately, but 13 hours significantly lowers the risk of breast cancer recurrence. So now what if you say, well, I'll do 14, 15, 16. There's very little return on investment for going beyond 13 hours. So why do it? It's like painful not to eat for so many hours. So, and then we don't want to, and the way that you have to do that, if you're going to fast longer, would mean eating dinner earlier, not eating breakfast later. So what you would have to do is stop eating earlier. Now, there was a study that was done with women with PCOS, which is one of my specialties, and it was out of Israel. And in that study, they had the women eat 2/3 of their calories for breakfast and 1/3, it was approximate, for lunch. And basically 1 bite for dinner, basically virtually no dinner. And obviously most people wouldn't want to do that. This was a study, but in just 1 month, their insulin dropped 50%. That, when you drop the insulin, that's how you can lose weight. You can't have high insulin and lose weight because insulin promotes fat storage and production. So that's amazing. The women started ovulating, which means their hormones were balanced. You have to have proper hormones to have a proper functioning body and to have healthy breasts as a reproductive aged woman. So this was phenomenal. So where did they have the fasting? From lunch to breakfast, not from dinner to lunch. So we really need to just get rid of that. And by the way, there's studies showing more plaque building up in arteries in people who skip breakfast. So we want to have fasting the way our bodies were designed to be fasting, which is overnight and not into the middle of the day. So you want to have a dinner, say you have dinner and you finish at 7 p.m., then you have breakfast the next day, you can have between 8 and 9. Otherwise, if you have to get up earlier and have breakfast earlier, then you have to move dinner earlier, or you have to work around it. Okay, so that is what is optimal, and it's not like we have a choice. Okay, we are programmed with clock genes. So we have our master clock in our brain, and then all of our other cells in our bodies have clock genes. About 1/3 of the genes in our body are what they call clock genes, but 90% of the genes in our bodies work with clock genes. And these are set in our DNA. These are not like, you know what, I think I would rather live the life of a bat. No, you can do it, but you're not changing your genes. You're working against your genes. So you're going to have problems. It's like, I would like to wake up tomorrow and have a third eye on the back of my head. That would be convenient for when I'm driving because my car doesn't have a camera that goes to that, I'm driving an older car. So I don't like turning around, I just want another eye. You can't do it. We are what we are, like owls look like owls and humans look like humans. And our clock genes are embedded in us, in our genes, in our DNA. It's who we are. So when we live in discord with how our bodies were designed to live, we are going to have medical problems. We're going to have mood problems, metabolic problems, and that sets the stage for cancer because everything is off the beat. And that's really important. And it doesn't matter, that what we want, it matters what we are. And so we have a whole society of people, and I was one of them, that work at night. And this is such a challenge. There's data published that women who work the night shift have higher rates of breast cancer. They also have higher rates of diabetes, metabolic syndrome, depression, obesity. It's not a good picture. So and I don't have a solution for people who chose a career where they're going to have to work at night. And the worst are like the doctors who work emergency rooms, or nurses that are on and off because there's no consistency. So they're like three days a week they're working at night, and then 1 day a week they're working in the day, and then the others are doing whatever they want. So they're constantly in a metabolic dysfunction because they're always off the beat. They have no consistency. So for people who do work at night, and this is a tough one, it's best to what I recommend is that you eat only 2 meals a day, 12 hours apart, regardless of whether you're working at night or it's a day job, or like sometimes you switch, you work the day shift, the night shift, or you just have days off. So try to eat 12 hours apart to at least try to keep the beat, and try to sleep, like whether you're working the night or not the night, to try to sleep the same times every day, so that basically you're creating a new time zone. It's like Susie time zone, so
Right.
that, you have some consistency with your life. Because, you can live like, I'm like typically 12 hours from Dubai. So I could live in Dubai time in California where I am. But what that would mean is that I would have to actually like sleep every day during the day, and then be up every night, and eat at the same time every day. And basically I'd be like living on the other side of the world, but I'd have to do it 7 days a week. But nobody really wants to do that. But if you're working a night shift, that would actually be better for you if you actually just lived as if you were in a different time zone all the time.
Right.
It's a challenge.
Yeah. So definitely getting, eating on a regular timeline with a good breakfast, and then making sure you get that light exposure. Is there anything else that is really supportive to get you back on the beat, so to speak?
Oh, absolutely. So when you exercise is like the miracle medicine that most people don't use. And there's actually data showing that when we exercise can have a different impact on our body. So if you want to lose weight, the best time to exercise is in the morning. If you want to build muscle, the best time to exercise is actually in the afternoon. And if you exercise right before you go to bed, then that will just potentially disrupt your sleep. Now, some people say any exercise is better than no exercise, so you make the best of it. But, it's always nice to know what's optimal. So optimal is not exercise right before you go to sleep. And weight loss, which so many people want to lose weight, is exercise in the morning. When you exercise, they've actually shown that you increase the diversity of your gut microbiome. So you're actually doing wonderful things for your gut microbes. And we know that they are like our cousins. So it's really interesting. We've not known about these incredible microbial populations called our microbiomes until relatively recently as well. And they are really part of us. They are synergy with us. And so we want to nurture them. So exercise and eating the right foods. So, we talk about when you eat, it's of course also what you eat. So I'm a big plant-based person. So because plants are what the microbes love. So when we're eating, how we talk about, because I'm an OB, when we're eating for two, right? Well, we're actually eating for trillions. So we have to feed those trillions of microbes in our gut, and they love plants. That's what they eat. They love having the polyphenols. They do like a dance with them, and the fiber. That's what they ferment. And that's how they make the short chain fatty acids that actually act as signaling agents to our brain and our liver. They actually have receptors. So, talk about synergy. It turns out that these short chain fatty acids, these metabolites of fermentation from the microbes in the gut, that there's actually receptors for them on our vagus nerves. That talk about how we're together, we're like one. So when you have butyrate, which is one of the short chain fatty acids, it actually combined on receptors on the vagus nerve, and it makes our brain happy. And it can actually cross into the brain and actually is like brain food because it's a fatty acid. And it also acts as food for the lining cells of the gut, but it also acts as a signaling agent to the liver. It's just amazing how we have to feed those little critters or they cannot do their job, which is to keep us healthy. So we want to really make sure that we eat a high plant-based diet. They talk about primitive type societies. There aren't very many left on this planet, but when they looked at the children's GI tracts, they found that the children had enormously different gut microbial populations than children that live in like Western Europe. And they had tremendous diversity, numbers and diversity. So in order to create diversity, you have to have a diverse diet. So some people say, I eat vegetables, I eat broccoli. And now I'm not against broccoli. I'm very pro broccoli, but you can't just eat broccoli and be a really healthy person. So that's where they come across with eat from the colors of the rainbow, lots of diverse types of plants. I say go to a farmer's market when you can, or go to a store like Mother's Market, Whole Foods, where they have diversity of all kinds of plants, and then just buy something from everything and experiment. You can get recipes in the store, you can get recipes online, you can get this, like, everyone wants to help you to cook and try these different types of vegetables. And when people, and this, I see it all the time, they kind of make these little wiggly things with their nose when I, say I like vegetables. They'll say, I hate vegetables. And it's like, there are ways to cook vegetables that no one taught you, that you will love them. And worst case scenario, cover them with a little coconut oil and put on pumpkin pie spice and then, and boil them or bake them. And then they'll just all taste like pumpkin pie to you, So just, you can find ways that you can enjoy vegetables, because they are critical, not just for their minerals and their vitamins and their antioxidants, which are so important, but also as food for all of those little critters in there. So we definitely want to make sure we take care of them. And then the other thing is to actually do fast, like more than just, so when you don't eat for part of the day, that technically is fasting, but we actually don't call that fasting in the verbiage that we use. We call that time restricted eating. So when you don't eat over a 24-hour period, that's called time restricted eating. When you don't eat for at least 24 hours, that's called intermittent fasting. And when you don't eat for a few days, like 4 days or 5 days, that's called periodic fasting. If you don't eat for at least, over, 10 days, that's called prolonged fasting. And actually that is not good, because then your whole metabolic system changes and your metabolic rate slows, because then you're in basic survival mode. But there's this amazing sweet spot, like 4 or 5 days. If you fast, like water fast, don't eat any food, then a lot of mechanisms are triggered in the body that are very restorative. You can actually burn liver fat, which is really critical, because you cannot be healthy with a fatty liver. And you actually increase the production of brain growth factors, brain-derived brain growth factors that actually make your brain healthier and happier. And they're doing research now looking at, reducing Alzheimer's and dementia by doing fasting. So it'll be really fascinating when these studies come out. But it also does other amazing things. It causes crappy cells in our bodies to die. I mean, that's programmed self-suicide. And if you constantly eat, you never stop eating, the body doesn't deal with that whole factor of killing off crappy cells. And you want to get rid of crappy cells, because they're the bad cells that do you in. We want to like clean house, get rid of the junk cells. And that's what gets triggered when you do periodic fasting for 4 or 5 days. And as well, the good cells in the body get rejuvenated. It's like from within. We call that autophagy, where you actually take the different cellular components. They go into, I call the recycle bin. It's the lysosome. And then it recreates from the proteins of the cell and the fats of the cell, fatty acids and amino acids. And then they reconstruct new cellular structures. So it's really like a total cell rehab. And this is amazing. And then once the crappy cells kill themselves, the stem cells of the cells, they get stimulated. So you end up creating a bigger pool of stem cells. And as well, you actually replace all the crappy cells with beautiful new cells. So it's like rejuvenating internally the cells and rejuvenating the organs. Yeah. So it's like, it's amazing. Now, here's the problem. To tell my patients that you should, okay, stop eating for 4 days and just drink water. And I want you to do it like every month for 3 months in a row. And then I want you to do it 4 times a year. You get compliance of about 1%. Even though, because people love to eat, we evolved in a time, in ancient times when food came and went. So people didn't fast because they wanted to fast. There just wasn't food around for sometimes for a few days. And so we evolved into that scenario to be optimally healthy for the environment that we evolved in. But now we have food everywhere we turn, and we really love eating. So what the company that I work with, the fasting mimicking company called L Nutra, created out of the research of the Longevity Institute at USC, a fasting mimicking diet. And that's what I do myself. And that's what I use with my patients, because otherwise I have good theory, but no actual success. So what a fasting mimicking diet is, that they created food that you eat for 5 days. Now, it's not a ton, but it's very tasty. You get 3 meals a day that flies under the radar of detection of the nutrient sensors in the brain. So I call it self-food. So it's like the best of all worlds. You get to eat, but your body doesn't know it and thinks you're fasting. And you also get the benefit of eating because you get the nutrients. You get the pleasure and the benefit of eating, and then you get the benefit of fasting. So that's why it's so brilliant. And so we have the data that we have on it shows that it does do the things that I mentioned, like it helps to burn liver fat, it helps to do the autophagy, trigger autophagy and stem cell stimulation and so on. And they're doing something like 40 studies right now, looking at pretty much everything that you can imagine. So as we stay tuned and we see more data, but just based on what we do know now, I utilize it all the time because I know enough that I love it.
Mm-hmm. Well, yeah, I'm curious too, is there a specific time of the month that it's most optimal to do?
Well, the data that we have is based on some interesting data that was done with NIH-funded studies back in the 1990s. Isn't that amazing? There was like this brief, I don't know what actually made it happen, but there were these studies that were done back in the 1990s on fasting and with women's cycles. And we need to recreate new ones. We need to have many new studies, and that's where we're heading. But right now, looking at the older data, it would look like if you fasted during the follicular phase of a menstrual cycle, you were more likely to impact the ovulation. Now, what they showed was that if women were very thin, then they didn't ovulate at all. If women were normal weight, they ovulated, but their hormone spikes were lower. Okay, so basically, I think it's best if you can avoid doing fasting during the follicular phase. So that would be from the time you get your period until halfway through the menstrual cycle, which is when you ovulate. And it would be better to do it during the luteal phase, the second half of the menstrual cycle. And there is actually some data published that when you fast during the luteal phase, that it actually improves heart rate coherence, or what we call heart rate variability, and it lowers the sympathetic and increases the parasympathetic. And what that means is that you're calmer. You feel better. So I would love to get some studies on fasting and PMS, because I think that it's going to really show that it's women who do have problems with mood disorder and so on during the luteal phase, and they have the PMS, that by doing fasting during that time, maybe even a small fast, like 2-day fast, that it will really help them dramatically to feel better. So there's so much interesting material that we have and that we need to acquire more, because this just wasn't on very many people's radar. It was just like a little blip that happened in the 1990s, and then it just all disappeared. And now, fortunately, it's coming back. And so we can learn more about how to really apply fasting specifically to women, because I talk about this all the time. Women and men are so different. We have really different immune systems, metabolic systems. We have different hearts. And most of the studies have been done on men in everything. So it's time for us to take the spotlight and to really understand. But I do, based on the data we do have already, I recommend fasting during the luteal phase. And I think especially for women as they're transitioning into the menopause years and the early menopause years, that incorporating fasting is going to be shown to be so vitally important to maintaining their metabolic homeostasis, sort of keeping their metabolism on track, because the hormone fluctuations fluctuations that occur during the premenopausal transition years can be crazy. It's like being on a hormonal roller coaster, and mood swings and sleep problems and so forth. And I think that there's a lot of potential by incorporating fasting and time-restricted eating and exercise. And of course, one of my favorites is some form of mind-body medicine. I personally love guided imagery, but some people prefer meditation. For me, I worked on meditation, but I kept trying to plan my day. It's like, no, I'm meditating. I'm not planning my day tomorrow. But when I do guided imagery, which is sort of a form of entering into a hypnotic state, but or a guided meditation where you listen to a beautiful voice with a beautiful music in the background, and it takes you on a mind journey so that you're taking yourself into a beautiful visualization as opposed to trying to empty your mind, because I just would fill it with thoughts. So
Yes.
I just said, I'm just going to do the guided imagery, and there's wonderful data on that. So for people who don't have time to really practice and learn meditation, you can buy or download very easily, very inexpensively, these guided imageries, and you can do them every day, and you'll be amazed. By the way, if you do it and you immediately fall asleep, that's a clue. You're probably sleep deprived, so you should go to sleep earlier that night, but keep listening to your guided imagery.
Beautiful. Well, thank you so much for sharing your wisdom here today. And I'm curious, is there any question that I didn't ask that you wish that I would have asked, or any last words you'd like to share with everyone?
Well, yes. When women get breast cancer, in terms of breast cancer, it's really a sign, and we sort of touched on this, but I just want to emphasize it, that there's inflammation in the breast, that this is really a sign of a local inflammation in the breast, and it's always accompanied by a systemic inflammation. So it means that the whole body is inflamed. And we didn't touch on, like, when you have a mammogram and it says you have dense breasts, because still the bulk of women who do get breast cancer are postmenopausal. Unfortunately, it's growing in premenopausal women, and that's really because of the ubiquitous endocrine disruptors, these chemicals that are altering the way our normal hormones are working, and they're really toxic. But if we look at the postmenopausal women who get mammograms, and then they say, oh, you have dense breasts, and that's a risk for breast cancer. I'm sure people have heard this, right? You have dense breasts,
Yes,
you
I
have
hear
a
that.
risk for breast cancer. But what does that mean? Why do you have dense breasts? I think this is really an important message. It means you have inflammation in your breasts. Now, breasts, like many organs in the body, make estrogen. So estrogen is made in ovaries. Everybody knows that. But estrogen is made in many organs themselves. That's how men and children get estrogen. Men and children are loaded with estrogen, but it's not circulating. If you get a blood level, it's going to be very low because it's made in organs, like in the brain, in the heart, in the blood vessels, in the breast. So breasts make estrogen because estrogen is a modulator of inflammation. It controls inflammation. So when you have an inflammation going on, the body makes more estrogen. In fact, if you have a brain trauma, there are actually cells in the brain that will make more estrogen to help reduce inflammation in the brain. It's an amazing, adaptive mechanism of the human body. And if you have inflammation in your breasts, the breasts will make more estrogen, trying to control that inflammation. But if you have a breast infection, that's why you have it. Like if you're breastfeeding and you get a breast infection, the body wants to control that inflammatory response so it doesn't go too crazy, and then the women will stop breastfeeding, the baby will die, because remember, it's all about survival, all of these mechanisms. So the breast makes estrogen to control inflammation. But when you have postmenopausal inflammation, systemic inflammation, you cannot control it with estrogen in the breast. This is too pervasive and ongoing. So but the breast makes estrogen. So that's what makes the breast dense, because estrogen is about growth and proliferation. So you're growing more of the ductal cells, but the goal is to actually put out and reduce the inflammation. But when you have chronic, unrelenting inflammation, and then in the breast, and then you have chronic, unrelenting production of estrogen in the breast, because estrogen is doing what it's designed to do. When you have chronic inflammation, that can lead to DNA breakage, and then you can get cancer. And estrogen is about nurturing and healing, okay? Proliferation. It's to help heal and grow. Like you get a cut on your skin, estrogen actually in the skin helps it to heal. Estrogen creates growth factors and new blood vessels, which is about healing. But now in a breast situation where you now have developed breast cancer, estrogen, we did not evolve to have breast cancer. So estrogen doesn't recognize that that's cancer. It just thinks it's injured tissue and it's trying to heal it. So it creates new growth, new blood vessels, and it's actually nurturing breast cancer. But estrogen was doing what it was supposed to do. It was trying to put out the inflammation, but now everything changed. Everything's like topsy-turvy because you get breast cancer. So if you are a woman and you have dense breasts on a mammogram, that doesn't mean that you shouldn't, I'm not saying you shouldn't like do more surveillance, because that's sort of the standard approach. Do more surveillance, like get more mammograms, get ultrasounds. That's fine. That's about early detection. I'm really focused a lot on prevention. Okay, so that's a sign you have inflammation in your breasts. You have inflammation in your whole body. It's not just in your breast. You're not like a breastfeeding mom and you have a breast infection because of breastfeeding. You have inflammation everywhere in your body. So you need to take action. Not stop doing surveillance, but start taking positive steps to lower your inflammation and lower your risk of breast cancer by doing all the things that we talked about, by getting on the beat, by eating the right foods, by getting enough sleep, by getting light into your eyes, by having meditation, working on stress. You can reduce your risk of breast cancer, not just try to find it early. Because I'm not against finding it early, but I want to not have women go through that in the first place. So take charge. When you have dense breasts, that's a big red flag that you are an inflamed woman, and take all the steps to lower your state of inflammation, lower your risk of breast cancer, lower your risk of cardiovascular disease, of dementia. All those things go together. It's one body, and fortunately, it's one approach to getting optimally healthy.
That is such great wisdom. Thank you so much. And I appreciate you being here today and for sharing. And I'm curious if anyone wants to learn more about you and connect with you, what's the best way for them to do that?
Well, I'm what I call an old-fashioned doctor. I have a brick and mortar practice in Irvine, California, called the Integrative Medical Group of Irvine. And my website is integrativemgi.com. And I want everyone to follow me on Instagram because I'm just getting going. I've not been like a social media doctor. I'm like a regular, hardworking doctor, but I'm getting going with my Instagram. And my Instagram has my name. It's Dr. Felice Gersh. So it's Dr. Felice Gersh. And I want everyone to follow me on Instagram because I'm going to really post really good stuff. And I need to have help because I'm just, like I said, brand new into the social media world.
Beautiful. Well, I'll follow you and I'll make sure to add that in the comments and in the notes as well.
Thanks so much.
Yes. Thank you so much, Dr. Gersh. It's been a pleasure having you here today. And